There we go. So that we have a copy of this awesome presentation. But let me go ahead and introduce Al Romeo from the Mother to Baby Utah program. And Al's going to tell us a little bit more about fetal alcohol spectrum disorders and what we can do to help. So take it away, Al.
Thank you for having me out today. I appreciate it. Thank you for the introduction. Just a couple of kind of housekeeping things. You'll have access to the slides, so don't worry about writing everything down. You can use the slides as you do trainings and informational different types of things with other groups that you work with. You don't have to use all of them, but you can reference them. In the slides, I have some notes, and you can look at those notes. Now, I may say a little bit differently than that, but you have the notes of kind of my prepared remarks there so that you have access to all of that information there also for whatever training that you want to do or your notes. So yeah, I'm Al Romeo with Mother to Baby Utah. I'll talk a little bit more about what we do, but we're going to talk about fetal alcohol spectrum disorders. Please interrupt me if you have questions. We'll go kind of fast so that we have plenty of time for more questions at the end. But yes, interrupt me. Let me know what kind of questions you have. I work at the Utah Department of Health and Human Services. Our project, we'll talk a little bit more about it, is getting some support from the Division of Substance Abuse and Health. Just a reminder, make sure that you mute your microphone so that we don't hear your conversation.
Trying to turn it down and it won't. It says.
So we're going to talk a little bit about FASD. We're going to talk a little bit about the campaign. We're going to talk about the training process that we're going to do, a little bit about the background of FASD, some historical kind of things, alcohol use in pregnancy, the different range of things that are under that spectrum, ICD-10 codes, some family support, different types of things. So a variety of different things. This is, you have access to the slides. So a little bit about what we do. We are Mother to Baby Utah. We are your teratogen information service here in Utah. A teratogen is something that is external to the fetus that causes birth defects or other problems. It can cause developmental delays, functional problems, any of those different issues. That's kind of under the umbrella of birth defects. It doesn't have to be a structural defect. So when we're talking about birth defects, yes, we talk about alcohol and Accutane and lead and mercury and all of those different types of things. We answer questions about any of those different exposures. So if you have questions about marijuana, hair dye, scuba diving, occupational exposures, vaccines, diseases like diabetes and how those affect the pregnancy or the breastfed baby, we are happy to answer any of those. We get lots of questions during COVID-19 for those vaccines and the diseases. Like it says, we're at the Department of Health and Human Services. We've been around since Mother's Day, 1984. So quite a long time. And we have been fortunate enough to receive a little bit of funding to have a collaborative group that includes some of your folks to run the Drinking and Pregnancy Prevention Campaign. It is modeled after what Representative Stenquist has proposed a couple of different years in the legislature, trying to, yes, prevent fetal alcohol spectrum disorders, drinking alcohol during pregnancy. So just kind of be aware that's kind of the structure of what we're doing with the campaign. We have a steering committee working group. If y'all are interested in being part of those meetings that we hold twice a month, let us know. We're happy to have you for that. But you'll hear more about it as we get the media vendor on board and start getting all of that media stuff happening. So you'll hear more about it. So that's a little bit about the campaign. We are Mother to Baby Utah, like I says, and we are a local affiliate of the national organization, the Organization of Teratology Information Specialists. So there are 13 different affiliates across North America. The 14th is getting started back up in Toronto. So we are kind of regional groups. We cover different states. Here in Utah, we just cover Utah, but some of the other ones like California, they cover the states and territories kind of on the west and all of those other different territories. So there's a few of us in the US, and we all basically do the same type of thing. I'm a member of that professional society, and I'm on the board. So yes, we work very closely hand in hand with that organization. One of our past presidents is Dr. Kenneth Lyons Jones. The reason I mentioned Dr. Jones is kind of a little bit of a historical perspective. If you know much about fetal alcohol spectrum disorders, Dr. Jones is one of those individuals that first identified it. So we have a strong connection to, like I says, alcohol, as that's something that causes birth defects and developmental delays. So I already mentioned a little bit about the campaign. Like I says, you're going to be seeing more about it. Watch for those TV ads and those different types of things. There will be information available out there. We are hoping, kind of similar to what you do with the Parents Empowered campaign, you provide a little bit of information to your local region about, underage drinking for the Parents Empowered. And we hope that you will weave some of our messages into some of the prevention strategies that you're already doing. So that's what we're hoping for and asking for. So yes, you work with those local community groups. We realize that you are in a much better place to do that primary prevention than I am. So for example, here at Mother to Baby Utah, we get questions all day long about a variety of different exposures. For example, I once had a question about alcohol use in pregnancy. Mom was drinking a 1/5 of alcohol per day, and she was already in her second trimester. So you can imagine, I'm not doing any primary prevention at that point. I'm trying to make sure that she gets in contact with her provider. I'm trying to encourage her to go to a treatment center. I'm trying to make sure that we reduce any possible harm for the rest of the pregnancy. Nothing I could do about what happened already. So you guys are in a, like I says, a better place to do that primary prevention. You talk about, like I says, Parents Empowered, getting them to not drink when they're underage, working with their primary care providers, the family practice providers, or somebody had a question for us. I see in the chat somebody asking if we work with NoFast. We in Utah, we don't have a local chapter of NoFast, but we have had some conversations with them and looking to them for some training. So I hope that answers that question. But like it says, the primary care providers, those family practice docs, the OBGYN that sees mom before she gets pregnant, has that opportunity for primary prevention. Like it says, if she calls us, she may not be able to get to her OB before weeks 8 or 10. And at that point, those structural malformations would have already happened. Those structures develop early in the first trimester. Of course, with alcohol, we have those developmental delays that happen later, and we'll talk more about that. But like I says, you guys are in the prime position to do some of that primary prevention that I just don't have access to those populations. So I hope you'll help us out with that. Like I says, weaving some of these different messages into what you're already doing. All right, let's go to the next one. What we are going to do with the campaign, we set a little bit of funding aside. The media vendor, once we have them going, they're going to be able to provide you with materials. And if you need other materials for some of the things that you're doing, let us know, and we'll let the media vendor know, and we'll see if we can produce some of those materials. We want to provide you with those materials. We figured out that it wasn't going to be easy or quick or practical to set up contracts for a small amount of funding for each of you. So we're going to just give you materials and make that happen that way. So if you need swag for the different processes that you're doing, let us know. We'll figure that out. All right. So like it says, we're going to talk a little bit about what FASD. Remember that each family's experience is going to be different. Each individual's experience is going to be different. We're going to talk about the range and what some of those things could happen, but we're going to talk about some generalities, and yes, everything is going to be a little bit different. So we talked a little bit about Dr. Jones and one of his colleagues, pediatricians, identifying FASD. It was actually identified by a French physician a few years earlier, but nobody was reading his reports, his journal publications. So, oops, advance that back. So
I've got to do this meeting that I'm doing right now.
Just remember to put your microphones on mute.
Yeah.
So yeah, with the French,
and then I can do the
it was identified a little bit earlier than Dr. Jones and his colleague identified it back in 1968. You can see there on the slide.
Okay.
So when Dr. Jones and his colleagues, Davis Smith, identified it, there was a lot of pushback. Of course, alcohol has been around forever. And Dr. Jones, if you look at one of it, you can Google it, and he talks a little bit about his first time identifying that. There's a YouTube video about that. One of his other videos talked a little bit about historical references to problems with pregnancy and alcohol. So we have seen some of this. If we go back and look at, people kind of knew that alcohol might be an issue, but we really seen that, yes, since the 70s, it's really come to the forefront of talking about preventing alcohol use in pregnancy. Just a couple of other historical bits. There was a place in South Africa where the local population made wine. They got paid in wine, so they had a lot more incidents of FASD. So there are some of these different things. Also, before the 70s, sometimes when moms were in labor, they were given alcohol intravenously, an IV of alcohol to help with sedation. So yeah, there has been some different experiences with alcohol in pregnancy before. So just kind of be aware of that. So looking at the prevalence, it looks like it's somewhere around 11% to 50% per thousand. So that's about 1 to 5% in the general population. That's more than Down syndrome. That's more than autism, but you hear a lot more about those other ones. So generally people know that they shouldn't be drinking alcohol, but they usually don't know why. So that's why we're doing the campaign, to talk a little bit about it. And that's what we're going to talk today, this training, to give you a little bit more information. So yes, alcohol use is very common. It's not needed during pregnancy. So yes, we're asking people to avoid alcohol during those 9 months of pregnancy, because those things that do happen can last a lifetime. And we'll talk about specifics. Kind of to give you the financial spin on it. So it does cost a lot of money. It's built into a lot of things that we do already. We don't have a lot of good data on FASD here in Utah. Nobody tracks it. It's not one of those birth defects that you see at birth. There may be some of those structural malformations, like we're talking about heart defects. So you may see a heart defect, but you may not put it together that that's from alcohol and call it fetal alcohol syndrome until the child gets into school. So a lot of times we miss that up front. Like says, there's no good data on it, but we do know that the costs of alcohol, fetal alcohol spectrum disorders, cost in the range of $800,000 to $2 million over the life of that individual. So we're going to do a little exercise. So if we look at old data from 2015, that's the last time PRAMS looked at data, we had a 2.6% of pregnant individuals that reported here in Utah drinking in their third trimester. So if we take that 2.6% and we look at those individuals, not everybody that even has those higher types of exposures, binge drinking, daily alcohol drinking, even those aren't going to cause FASD every single time. So we'll narrow it down a little bit further even. And we'll just say out of those 45,000 births that happened, let's say 2021, out of those 45,000 births, we had about 1,174 infants that were exposed to alcohol sometime during the pregnancy that might be on that range of FASD. I'm sorry, that might have been exposed to alcohol at that 2.6%. Now we're going to decrease that for those that probably were on the FASD range, because about 15 to 20% of those with those high alcohol use could have those different birth defects and developmental delays. Now, we're not going to talk about miscarriage at this point, but birth defects and developmental delays. So we're narrowing down to that 15 to 20% out of that 1,174 per year. So we're looking at about 88 infants per year. Now, if we take $1 million, not the high $2 million, but if we just say $1 million for those 88 infants per year, we're on the order of about $29,000 per year for each one of those 88 because they live about 34 years. So you take that 1 million divided by the 34 years lifespan, and you get about $29,000 per individual per year. So you got 88 individuals that are probably on that FASD range per year, and about $29,000 per year for each one of those. Add that up, and it's about $2.6 million for that one cohort for that 1 year. So about $2.6 million. The next year, you could have another 88 individuals, so another $2.6 million that year. So you can see that it adds up very quickly for the different cohorts. And like it says, with the different 34 years lifespan, you could have 34 cohorts living at one time times 2.6 million. So it adds up to be quite a sum. Now, remember that these different types of things, like it says, they're kind of built into everything we do. Early intervention, some of the substance abuse work that you're doing, some of the juvenile justice work, they end up in the different court systems. So there's a lot of those different costs that are in all of those different systems we work with. The school system, because they have issues with learning and behavior issues, those different types of things. So we're trying to reduce the amount of individuals that have FASD and those costs to society overall. All right.
Hey, Al, Lisa
yes,
had
go
a
ahead.
question for you in the chat. Do you want me to read that out?
Is it one I see? Are states looking at suing the alcohol industry for costs associated with treating the harms of the addictive product like they did with tobacco, some of those opiates pharmaceutical companies? Not that I'm aware of. Some of those different alcohol companies do some support of prevention of FASD and underage drinking and those different types of things. But no, I'm not aware of any lawsuits that are going after the companies for alcohol use in pregnancy. Thank you. All righty. So remember that alcohol causes more serious birth defects, so structural malformations, and the developmental delays that are under that than any of those other illegal drugs. So we'll talk a little bit more about some of those other ones, but if we could prevent two things, I want to prevent diabetes uncontrolled in pregnancy, because that's actually the biggest thing that causes birth defects here in Utah and across the nation, uncontrolled diabetes. So prevent uncontrolled diabetes and alcohol use. Alcohol is one of those things that we don't have to have during pregnancy. So that's why we say avoid alcohol during those 9 months of pregnancy. Let's just avoid it because it's not needed. Now, of course, substance abuse issues and all of those other different types of things, that's a whole nother issue. Like I said before, usually those individuals that are pregnant don't get in to see their OB until they're 8 to 10 weeks along. So they're not getting the information they need. They're not getting the counseling and treatment that they need until much further along in the pregnancy. All right. So a little bit about screening and prevention. So yes, we hope that those providers are asking about alcohol use in pregnancy. Some of the recent research reports show that they are doing some of that, at least. They may not be using the standardized tools, but they are asking about alcohol use. Oftentimes, though, even if they ask about alcohol use, they're not providing the message of avoiding alcohol use for the rest of the pregnancy. So we hope that they increase that message. Again, we understand that it's part of the substance abuse issue. They may have anxiety or depression and maybe self-treating with alcohol. So there's a lot of other things that are going on. But, you know, those different providers, like I said, even the primary care providers, the family practice providers, even the pediatricians that see the babies from the previous pregnancy, they have that opportunity to talk about some of these mental health issues, to talk about alcohol use, to prevent the next time. When we look at, for example, when we ask those questions, we try to do in a non-judgmental way, and we try to overstate the amount of alcohol. For example, I may ask, how many 6-packs per day do you drink? that kind of gives them the permission to say, well, I don't drink 3 or 4 6-packs. I only drink a couple of beers a day. So overstating that kind of gives them permission to talk about the lower amounts. All right. So in those different public messages, like I said, you're going to see no alcohol use during pregnancy. We do know that the things that cause the most harm, the most risk for fetal alcohol spectrum disorders are binge drinking and daily alcohol use. So those are the most concerning types of drinking. Now, if somebody calls and they said they had 1 drink of alcohol for their New Year's party and they were, 4 weeks pregnant, is that going to cause somewhere on that FASD range? Not likely. But the research is fairly unclear for those lower amounts of alcohol. That's why we just say avoid alcohol use anytime during the pregnancy, because we just don't know metabolism for mom and baby and that pair together. So just better to avoid it. But just so you know, not likely that a single drink would cause that problem. Oftentimes we get questions about my mouthwash. My medication had a little bit of alcohol in it. I use alcohol on my hands as hand sanitizer. No, those different types of things are not likely to cause problems during the pregnancy either. But again, when we do those public health messages, we're talking about, yes, avoiding all alcohol use, kind of like what you do with some of those other substances of abuse. All righty. Standard drink sizes, just a mention about that. When we talk about alcohol use, we're talking about those standard drink sizes, a 12-ounce beer, 1.5 ounces of hard liquor, 5 ounces of wine. Remember that the drinking cup that somebody uses may be different than that. I once had somebody say, well, I only have this 1 cup of liquor a day. It's a mixed drink. It has some alcohol in it. It has, my fruit drink in it. When we started looking at how much alcohol was in it, it was about 3 servings per that 1 cup that she had a couple of times a day. So again, you need to think about how many servings of alcohol, and that's kind of where we get into the binge drinking, the 4 or so servings of alcohol in a sitting. Okay. We talked a little bit about the PRAM survey. Like it says, 2015 was the last time we had good information. Now they've started that question about alcohol use in pregnancy back up again. They stopped in 2015, but this year they started it up again. So hopefully by next year, we'll have some good information again. But like it says, we had about 2.6% using it in the 3rd trimester last year. And like it says, we get, 45,000, 47,000 bursts per year. So that's kind of where we get that number for how many might be exposed to alcohol per year. Oh, and just kind of an aside, yes, here at Mother to Baby Utah, we're here to answer those different types of questions. I don't expect you to talk to a mom and counsel her about her alcohol use. That's what we're here for. That's our job. So she can call us and ask about any specific type of alcohol use, and we'll walk her through that. All right. So like I mentioned before, usually people know that they shouldn't use alcohol, but don't know why. So in this study, from FASD United No Fast, yes, people knew that they shouldn't be, using drugs, knew that they shouldn't be drinking. So less people are getting the message from their provider. So hopefully we'll be able to provide some training to providers so that they provide a consistent message also about avoiding alcohol and stopping if they do see that pattern happening. Okay. Fetal alcohol spectrum disorders is a range of different things. It's not a diagnosis. There are different diagnoses, and I've listed them on this slide under that umbrella term, kind of like autism spectrum disorders. Autism spectrum disorders isn't a diagnosis. You could have autism, you can have Asperger's syndrome. So there's various diagnoses under that umbrella, that spectrum. Same with fetal alcohol spectrum disorders. There's that fetal alcohol syndrome, and that's the classic one. We'll talk a little bit more about it. And then there's some of those other ones. We'll mention those briefly. So just so you know, there are different diagnoses, but FASD itself is not a diagnosis. ICD-10 coding. You guys know about ICD-10 coding. Just remember that there are only 2 codes that have to do with alcohol and pregnancy. The first one is that fetal alcohol syndrome, that full-blown classic case. And then the other one is newborn affected by maternal use of alcohol, that covers everything else, all of those other ones. So if you're, billing for it, that's what you're going to see. If mom and dad, have questions about, what's my child's real diagnosis? Why isn't my doctor billing for FASD? It's because these are the codes that are available for billing. It's kind of a weird thing, but that's just kind of how it goes. Okay, so like it says, the fetal alcohol syndrome is kind of that full blown. You see those facial features, and we'll talk more about what they specifically are, but they usually have the facial features. They usually have some of those structural birth defects, developmental delays, and then you have to have that documented information about mom's alcohol use during pregnancy. So the partial FASD is for those different ones that you may see all those classic signs and symptoms, but you don't have the documented alcohol use. So just kind of be aware that some of these, they can have documented use or not documented use. So like it says, FAS is that full-blown case. Then there's the alcohol-related birth defects. So they may have some of those structural birth defects. Remember that those birth defects usually happen early in pregnancy. So if mom was drinking early in pregnancy and then stopped, it's possible for her to have some of these different birth defects, but not the developmental issues later in pregnancy. Okay, so alcohol-related neurodevelopmental disorders. This is, again, those different developmental disorders. So those developmental disorders usually happen later in pregnancy as the brain is forming. So we're not seeing any structural defects. So this would be kind of less common. Mom starts drinking in the 2nd or 3rd trimester. Like I says, usually less common. So then there's the neurodevelopmental disorders associated with prenatal alcohol exposures. They could be neurodevelopmental, neurobehavioral. They may not have those physical features, but they may have some of those. So again, it's kind of that mix. So here's a chart. Don't try to remember it. Remember that you and I are not going to do the diagnosing. The pediatrician is not going to do the diagnosing. Usually what happens is somebody identifies some type of issue, whether it's they're in school and they have behavioral issues and somebody refers them to their pediatrician or their psychiatrist or psychologist, and they figure out something's not right and they do a little bit of investigating. Then they get referred to probably a developmental pediatrician. And ultimately here in Utah, they usually get diagnosed by a geneticist. So our medical director, Dr. John Carey, is one of those geneticists, dysmorphologists that works with some of the diagnosing of it. So again, your local pediatrician isn't going to diagnose this. It's going to be the pediatrician is going to notice something wrong and send them up the line for more diagnostics. So like, again, what you see here in this chart is some of the differences. So that A column, is there a confirmed use of alcohol? That B column, are there any of those facial features? C column, growth restriction. D column, those CNS abnormalities. Cognitive abnormalities in D, and then those structural birth defects in F. So there are different varieties, and that's how they get pegged under those different diagnoses. This is a helpful chart. The CDC puts this out, and you can actually get it from the CDC. It talks about when those different structures develop. So if I know that mom had alcohol during a specific time in her pregnancy, and we'll look at the specific week during her pregnancy, we can kind of pinpoint what might it be affecting. As you can see, some of those different structures develop at different times. The heart, some of those different birth defects, even the specific birth defects of the heart, they can happen at different times. So the more we know about exactly when she drank, the more we can look at, what might be affected. So yes, those different structural malformations usually happen earlier. The different brain development, neurodevelopment types of things usually happen later. Here's some of those classic facial features. Again, I don't want you to memorize it, but just know that there are differences in the eye. Even pediatricians have difficulty measuring these things and getting it just right. That's why usually a geneticist is the one that's involved in making that diagnosis. But changes in the shape of the eye, the space between the nose and the upper lip, it's usually more flat. And then the upper lip is usually more thin. Of course, there's variations for different ethnicities and races, but those are kind of the classic features. The eyes, that space between the nose and the lip, and the upper lip. Remember that some of these different characteristics can go along with other genetic issues. So seeing one of these things doesn't peg it as FAS. So again, they have to do genetic workup. That's why the geneticists are involved, to make sure it isn't something else. And again, the more we know about mom's alcohol use, the more information that we have to help with that diagnosis. Okay, so some of the areas that the brain is affected, remember that alcohol kills brain cells. So just about any portion of the brain can be affected. Yes, it can affect judgment. That's how they get in trouble with the law. They do things that they don't understand, aren't kind of socially acceptable. They don't understand those different rules. Like I said, they have learning disabilities, difficulty with social cues, those different types of things. So there's a lot going on with kind of the brain and how it works. Remember that these individuals, they are not doing these behaviors on purpose. So you've heard about different behavioral issues, and the kids act out on purpose to try to get attention. That's not these kids. This is a brain problem. They've lost brain cells. They have a brain defect. It's not something that they control. So you have to learn to work with these kids within their strengths and limitations, and just know that, yes, they're not doing this on purpose. Okay. So we've already talked about a lot of these different ones: developmental delays, executive functioning, motor delays, mood issues, attention, impulse control, communication, social skills, daily living skills. So some of these individuals that are on the more severe end of that spectrum may need somebody to care for them for the rest of their lives, that 34-year lifespan. So just kind of be aware of that. In addition to any of those different costs to society, it's going to be difficult for the family. If you've ever been to some of those different support groups for families, you know that they struggle with different behavior issues and learning issues on a daily basis. So it is a very difficult thing for the families to deal with, depending on the severity for the individual child. Here are some of those different variety of structural birth defects. We mentioned heart defects. Like I says, there's a couple of different kinds. The atrial septal defects, the ventral septal defects, the conotruncal heart defects. So like I says, a variety of those different types of heart defects, joint issues, vision issues, hearing issues, kidneys, those different types of things. So there's a variety of different structural problems that alcohol can cause at the different times during the pregnancy. Okay, screening and early intervention. You guys probably know about the developmental screenings. It's, great that they, Help Me Grow here in Utah is helping with those developmental screenings. Sometimes the local WIC offices, sometimes the child care providers are doing those developmental screenings. Oftentimes the primary care provider, the pediatrician, is just too busy doing everything else that they don't use one of those standardized tools like the ages and stages. They're encouraged to. They don't get to bill specifically for it. They get to bill for the visit, but they don't get to bill for that specific developmental screening. So oftentimes if the kid doesn't look like it's having any issues, they just kind of move on. Whereas the standard is to use those standardized screening tools. Okay, so that's a little bit about screening. You've probably heard about Baby Watch early intervention and then your local early intervention groups. Those different ones like, now I'm blanking on some of those. But anyway, your local early intervention groups that work with the kids, Part C. And remember that the early intervention only goes up to age 3. So like I said, oftentimes these kids aren't identified until they are in the school years. So after age 3, the school system takes over. And if there's any issues, the school district, the school system is kind of your resource to help them there. If they have any structural birth defects like the heart defects and those types of things, then yes, refer them to early intervention because there may be other issues that go along with those structural birth defects. Okay. All right, we talked a little bit about the diagnosis process, that somebody will figure out that something's not right. They'll refer them to their pediatrician. They'll get further assessments and referred up the line until they actually get to usually, like it says, that geneticist. Now, there may be other providers that help along the way. If they have bone issues, heart issues, those different types of things, there's going to be obviously those different types of specialists involved. So there's going to be a variety of different individuals that are going to help with the care of that child and the family. Here are some of those different examples: nephrology, cardiology, psychiatry, OT, PT. Just a point about OT and PT. You guys probably already know this. A lot of people don't remember that the families don't often understand. Sometimes they'll get referred to an occupational therapy and they'll say, well, my baby doesn't have a job. I don't need an occupational therapist. Well, when I worked in the newborn intensive care unit, we would have an occupational therapy come help with feeding issues. The occupational therapy helps with those daily skills. So the physical therapist is going to help with those kind of motor skills, movement, and those different types of things. The occupational therapist, like I said, is going to help with those daily living skills, whether it's feeding issues as they get older, it's, you know, self-care and dressing and those different types of things. So that's kind of, you know, how to explain it to families about the differences between OT and PT. Alrighty, as I mentioned, there's going to be other kind of comorbid conditions. They could have ADHD, anxiety, growth issues, and somebody's going to be addressing those different comorbid conditions, motor issues, behavior issues, all of those different types of things. Remember that these individuals need concrete examples. They don't do abstract thinking very well. So be very careful about your language when you're talking to these individuals. They don't get some of those colloquialisms, you know, concrete thinking, you know, they may be thinking about concrete outside. So be very specific in how you use your language and examples that you use. And remember that they need repetition of those different examples, and they may not remember from one day to another. So again, it's not bad behavior. Their brain just works differently. So you have to work with them within their strengths and limitations. Family support. Of course, there are different agencies. You guys are familiar with some of those different family support agencies. We'll talk about a couple of different ones and help the family along through the process because it's challenging for them also. Okay, a little bit about some of those other substances of abuse. Remember, I said that alcohol is the worst for pregnancy. That's where you get the most birth defects, developmental delays, and those different types of things. So smoking and tobacco, yes, we shouldn't be smoking tobacco or marijuana during pregnancy. The displacement of the oxygen can lead to low birth weight, preterm delivery, those different types of things. Some of the hearing issues have been linked to smoking. There's still a little bit of debate on that, but yeah, smoking can cause problems. The opioids, we don't see structural malformations with those. Every once in a while, you can see one of those different studies that links the different opioids to a structural malformations, you know, sometimes the cleft lip or palate or the heart defects, but we're not seeing those consistent. So what we're looking for in the research is those consistent patterns. Also remember that for any healthy pregnancy, there's always about a 3% to 5% chance of having a baby with a birth defect for any healthy pregnancy. So we always see some of those birth defects in every research report. We don't want to see above that background risk. And like I said, we're looking for patterns across them. So with the opioids, every once in a while, we'll see a study that might be happening from random effects. Remember, the more tests that they do within a research study, the more chance of that 0.05 random effect happening. So like I said, with the opioids, no, we don't expect those structural defects. Now, of course, there's, you know, if mom's using that opioid throughout the pregnancy, it's in baby's system. And when baby is born, baby's going to have a dose change. and have to get used to that lower dose. You may hear it called neonatal adaptation, neonatal withdrawal, that type of thing. So it is something that they have to deal with, but again, we don't see any long-term structural issues or behavioral issues from that. What we do know is those people that have addiction problems or mental health problems, there's probably something genetic going on there as a predisposition. So it's not the medication or the other exposure that's increasing the risk for the offspring to have those, but the genetics. So just kind of you're aware with that. So we talk to moms all day long about their mood medications. No, we don't see increased risk of birth defects from most of those. Some of them do, but for most of those, we don't see increased risk of birth defects. And again, not long lasting effects. Usually, like I says, if mom has depression or anxiety, more likely that the infant would, that the offspring grown child or adult would, just because of that genetic predisposition. So kind of keeping that in the back of your mind. Okay. Cocaine and methamphetamines, those are stimulants. Like I said, we don't see increased risk of birth defects for those usually. Now, if you're using them as illegal substances, then you get into all of those other issues. She not sleeping well, eating well, getting exposed to alcohol along with those, getting other diseases, those different types of things. Those can cause problems. But for example, if she's using her ADHD medication, low dose, it's a stimulant still, but no, we don't see problems with that. So even with cocaine and methamphetamine, we're not seeing the types of birth defects and developmental delays that we see with alcohol. Okay. So yes, as I mentioned, diabetes is one of those biggest things, and alcohol. So those are kind of the big things to kind of pay attention to, but wanted to provide that information about those other ones. Okay, you're probably familiar with some of those. Yes, somebody already mentioned NoFast, FASD United, the Proof Alliance that's out of Missouri. So some of those, or Minnesota, some of those different resources are available. The CDC obviously has information not only for families, but for professionals. Mother to baby, if you're outside of Utah, it's the mothertobaby.org, and that's where you'll find the fact sheet for alcohol. And then you can find those local affiliates if you're somewhere else. I mentioned Help Me Grow with those developmental screenings. The Utah Parent Center is that parent training and information resource center that's available to help parents, especially if they have issues with IEPs in school. The Parent Center is great to work with them on that. In some of the different school districts, they have a consultant that works directly with that school district that has a child with different developmental delays or other problems, not necessarily FASD. I mentioned Baby Watch Early Intervention and your local ones. They're the Facebook group for the support, FASD support. The parent that was running that was just too busy and couldn't keep up with everything. So that one, if I remember right, is shut down. So just be aware of that. Here's the links to some of those videos that I mentioned. Dr. Jones talking about his experience with FASD and the identification of it. The Medical Home Portal, if you haven't heard of that one, is a website out of the University of Utah Pediatrics that provides information about those different developmental delays, structural malformations, any of those different diagnoses that those children will have, and how the primary care provider can work with them, the medical home, and some of those other specialists. For example, if you have a kid with asthma, if you have a child with diabetes, all of those different types of things, you can go to the Medical Home Portal and find information on some of those different types of things. Again, the CDC has specific guidelines, that big old book that if you're looking for any of that resources. Department of Medical Genetics out of Pediatrics at the University of Utah, there's their link. Utah Developmental Assessment Clinics, again, that's where kids usually get started on the track to try to figure out what's going on before they get to the medical genetics. And then the American Academy of Pediatrics, their Bright Futures has that guidance for anticipatory guidance for all of those different types of things at different ages for the child. Might be helpful. Seat belts and all of those different types of things you're familiar with. All righty. So again, there's another one from the CDC, and of course, SAMHSA has information about alcohol. You can find those there. A little bit more about what we do at Mother to Baby. I already described all of that. You can find us through that 866 number anywhere in the country. It'll route you to the local affiliate. If you're calling from here in Utah, it'll route you here. Not only do we answer questions by telephone, text, email, and chat, so we have all of that variety available. So I'm happy to answer whatever kind of questions you have today. Thank you all for being here. And again, these resources are for you to use.
Awesome. Thank you, Al. Does anyone have any questions for Al?
Yes. Can you guys hear me?
Yes, go ahead.
Okay. I have a question that, so you said that stimulants, it's not a huge effect on pregnant women?
Correct.
Okay, gotcha. That's all. Thank you.
So with the stimulants, the biggest thing that you're watching for is hypertension and changes in eating. We want them to gain weight and we want them to not have high blood pressure. So usually, like says with the ADHD drugs, those don't do that. Now, like says with the cocaine and methamphetamine, illegal use of those, we get into all those other substance abuse issues.
Right.
You guys know about that. That's a whole different story.
Thank you.
Yeah, and you can ask me about alcohol or any other exposures that you have questions about. Yeah, anything, we've got some time here. So yes, hair dye and veterinarian kind of things and dentists and all of those other different types of exposures that moms would have in pregnancy and breastfeeding. Happy to answer those. Fair game.
Oh, why not? I have something to confirm then. So
Please, Wesley.
you said if basically the increased use increases the likelihood of fast. So
Generally, yes.
okay, so it's still a possibility that if one time they drink alcohol, they get that, but it's really low. Same thing then you said with like all of those other alcohols that we come across with like sanitizer and toothpaste and things like that.
Yeah, the sanitizers is just not going to get absorbed in enough of amount to cause those issues. Toothpaste, again, not going to get enough of an exposure. Theoretically, one drink might be able to do it. I can't disprove that. The research doesn't disprove that. It would be unlikely, but it is theoretically possible. Like it says, the binge drinking and the daily alcohol use is really where we see those problems. But all of that in between, if I had 2 drinks on 4 different occasions, does that cause problems? I don't know. So we would want mom to, work with her provider and watch for any of those different types of issues as baby is born and goes through school and those different types of things. So yeah, a lot of gray area in the middle. Thank you. Good question. Somebody else.
Gotcha. Thank you.
Yes, the tobacco quit line is there and available. And yes, we would definitely want mom to, take advantage of those different types of things. Tobacco is one of those things, the more you use it, again, the more oxygen that's displaced, the lower birth weight, and those different types of issues that have lifelong consequences. So the more we can get her into those substance abuse treatment programs, the better. Like says, not likely to see structural malformations from tobacco use. Like says, there is a little bit of linkage to hearing, but kind of questionable at this point. So yeah, definitely use some of those other resources. And if I understand correct, for some of those substance abuse treatment centers, pregnant individuals should have some priority, but I know they're usually overbooked. So it may not be practical that way. Other questions?
Okay. Well, if anyone has any more questions for Al, now's the time. But if you think of anything in the future, I'm happy to share his contact information. And of course, he's been gracious enough to share these slides with us. So we'll make sure to make that available for folks that weren't able to be here or were able to be here, but wanted to get more information, and we're recording today's presentation as well. So a lot of great resources, a lot of really great information. Thank you so much for being here, Al. We really
Thank you for
appreciate
having
it.
me out today.
Awesome. Well, we wanted to take a few moments to let anyone that may have any questions about the upcoming Bryce Coalition Summit ask those questions. We do have a few members of the planning committee that are on the call today, and happy to answer any questions that you may have about the conference, the agenda, the registration process. So does anyone have any questions that we can help clarify for you? Okay. Kevin, Mikkel, can you guys think of any questions that we've been seeing that you want to address on the call today?
Well, I just wanted to reiterate, and I apologize for, I'm in a noisy place, but well, I wanted to reiterate that we are really looking for any coalitions out there who have been able to, thank you, I'll get it in a minute, who have moved forward with their coalitions in any way, small or large, who have made progress, who'll be willing to, show off their coalition at the conference for like a 30-second, well, probably not 30 seconds, probably more like 2 minutes. Just like 2 minutes, like this is what our coalition did and this is why we're proud of them. Like that's what we're looking for. We've only had one coalition bite so far. So we are still looking for any coalition that wants to do that. If that's something you are interested in, please contact Taylor Passarella, and she will be able to get that as part of our agenda. Anyway, I gotta sign off for now. So good luck.
I'll drop my email in the chat.
Thanks, Kevin. Thanks, Taylor.
Heidi, do you want me to go over this form really quickly, just in case people don't
Yeah,
know?
no, that's awesome. Thank you, T. Yeah.
I will share it if maybe we could stop sharing and I could share this document, if that's okay. Awesome. Thank you. Okay. So you may or may not have seen this come through yet from your coordinator, but this year we are doing things very differently with the registration for Bryce. And so can you still see it, or did I move it? You can't.
It moved it, but we see your cute family. There it is.
Okay.
There it
I'm
is.
just trying to not look, I'm looking in the clouds, but I'll look in the clouds. So anyway, we're changing it up a bit. You may be aware we're having everyone pay for their rooms out of their own budgets and through their LSAA. But you have to go in and book your rooms prior to filling out that registration form. It's a Google form that we will send, that's been sent out. But Melissa went to a lot of trouble to be very specific on these booking documents. So the form that I'm showing you shows you that you just follow the instructions on here. It's pretty simple if you follow it. It's pretty complicated if you don't. It gets pretty confusing with the registration. So it shows exactly how you book. If you are not part of the planning committee, you're not part of UPN or the state meeting that Rob Timmerman slash Craig Pove, I don't know which one's leading that because of the transition, are holding, but you're just coming to the conference as a participant, make sure that you're filling in the right dates for that, because the registration will include dates for all of them. So just pay attention to the dates. Click over here if you need to edit. Don't click on the Best Western Ruby's Inn. That's not going to get you to the block of rooms that have been reserved for the summit for UPCA. You'll just be booking a random room, and they don't have any anyway. So if you look at the picture above, all the rooms booked through Friday, no matter when you arrive, don't check out. Do not change the checkout date on that. So the blocks are set. Anyway, these are the dates. If you're attending the state meeting, that's your check-in. If you're attending UPN, don't try to check in at a different time than you are allotted, because it will throw everything off. So anyway, then here you are to select the room, and you're good to go. It's pretty easy. Put your guest info here. You'll get a confirmation number once this is done, and that's what you use to register in that Google form. So it won't let you register unless you have that confirmation number. And the LSAAs will need to register each person individually. So, and then of course, if someone is unable to make it, please find someone that can replace them so that you don't lose the money that you spent booking those rooms. So I hope that made sense. If anybody has questions, oh, well, no, I'm just kidding. If you have questions, then just look through that email. It's pretty self-explanatory, but I think a lot of people didn't know they had to book the rooms first this year. So anyway, that's pretty simple.
Awesome. Thank you, T.
Yeah, welcome.
All right. Does anyone have any questions for Al or questions for the Bryce Summit Planning Committee before we sign off? Last chance? Okay. Awesome. Well, if you think of anything, feel free to reach out. In the meantime, thank you guys so much for coming and tuning into this webinar, and we look forward to seeing you in May. Thanks, everyone. Bye.
Bye.